Dr. Lawrence Loh, the Chief Medical Officer of Health for the region of Peel in Ontario. Dr. Loh, thank you very much for taking some time with us this afternoon. I do want to ask you, just what is the concern, if any, that you have around what seems to many people on the ground level to be mixed messaging?
Well, I think I would say not necessarily mixed messaging, but it's messaging that's apparently been taken somewhat out of context. And I think the context that the message was really provided was people really need to consider the risk of getting COVID versus the risks associated with a vaccine. And it's very clear, especially for us in the region of Peel, where we are in an extremely severe third wave, where we do know that your risk of severe outcomes and hospitalizations and also mortality, if you're unvaccinated, very much outweigh any of these extremely rare side effects with the vaccine products, particularly the one product in question. Our advice in Peel still remains the same. The first vaccine is a good vaccine because it means that you're no longer a threat to the broader community, hopefully, or at least reduces your threat to the broader community and offers you and your family some semblance of protection.
But are you worried at all about breeding hesitancy when you have vaccines that are designated as preferred? It makes the others, although they're not saying AstraZeneca is not preferred, they're not saying it's unsafe, but there is sort of an inference there that I think some people could interpret, wrongly perhaps, but on the ground level, are you concerned about hesitancy?
Yeah, I am concerned, of course, that stating a preference without speaking to the context, unfortunately, really challenges the message. But the reality is that the context is vital. So to use an analogy or an example, certainly for people who are trying to get from Toronto to Ottawa as quickly as possible, you might prefer to take a flight because you know that's quick. But if the train's the only thing available to you and you really need to get to Ottawa, then you're going to get on that train.
I take your point. When you look at sort of medical communication, and I think one thing that we've learned through the course of this pandemic is communication can be among the most important things that are out there. What would be sort of the grade you would give looking at the various steps, particularly around AstraZeneca, which has had these speed bumps along the process? And again, perhaps people broadly have misinterpreted it. Perhaps people like me in a studio like this have made a bigger deal of certain things than someone like you might like us to. I just really wonder ultimately what you see as the effect of some of those speed bumps along the way.
David, I think the thing that has been really missing around the whole risk perception around AstraZeneca has been its relation to severity of disease with COVID. I think there's been a real significance and a focus, which is part of good vaccine safety, by the way, to really try to understand this rare side effect, who's impacted by it, and how we can ensure that we can still derive the significant benefits of this vaccine while ensuring that we protect against the possibility of a rare side effect. But the reality is, if you look at the experience of a country like the United Kingdom, which had significant use of AstraZeneca throughout its vaccination rollout, they're now in the process of actually, beginning to gradually reopen and exit the pandemic. So I think the whole context of weighing the risk and benefit not against the vaccine unto itself, but against the broader question of what's happening with COVID, and especially because the global picture is we're starting to see AstraZeneca concerns in other countries which desperately need it elsewhere in the globe to end this pandemic. I think that context, unfortunately, has been what's been missing from a lot of the communications to date.
I wonder, just because of where you're speaking to us from, Peel, one of the largest areas in terms of population in this country, but also one suffering through this awful third wave, in part because many people work in essential workplaces in Peel, and many of those people are diverse, are racialized. Are you concerned that there could be creating an equity issue here when it comes to vaccines, when you talk about the ones that, if you wait just a little bit of time, are the preferred ones as opposed to the one you can get right now?
Yeah, and David, I would start obviously my answer by just reiterating that for us in Peel especially, we're really asking people not to wait. I think the preference only really applies in a context where you're not seeing a severe third wave as we're having in our community. But I agree with you that there is a concern, of course, that you now get to a situation where if you do have a choice before you, you have people that are essentially saying that they would prefer to wait when they could access protection. They might prefer to wait, and especially because of this perception that there's a second class or like a tier of vaccine, when they could very well access very good protection right now with, a much smaller risk than would be that would remain to them of illness if they had remained unvaccinated.
Can I ask you, I know you're very much still dealing with the day-to-day, but Ontario is about 2.5 weeks now from what is expected to be the end of the stay-at-home order. At this point, do you see a need to extend it? Do you expect that it will need to be extended?
David, we're continuing to look at the data and the trends. Certainly for us in the region of Peel, we have not yet reached the plateau of our third peak yet. We're hopeful by the end of this week that we can confirm what appears to be a flattening out and hopefully a decrease. And I think what is very positive and in our favor in Ontario is that we did, at least provincially, have reached 40% first dose coverage for the eligible population. We in Peel continue to vaccinate steadily. We're at 100,000 doses a day. It's taken us 5 days to get just from 500,000 to 600,000, and we are, targeting obviously 75%, 1.1 million people in our population. So that certainly gives me hope. But the question, as we all know and we've seen before, is that if we move too quickly to loosen restrictions, and especially if the coverage isn't quite there yet, we may find ourselves in a more severe situation in the early phase.
Yeah, certainly that seems to be how we got from the second wave, perhaps taking the restrictions off a bit too early, which ultimately created the conditions that led to the third wave. So, we've only got a few seconds here, but at this point, can you see 2.5 weeks from now significant reduction in restrictions in Ontario, or at least in Peel?
I don't think it'd be significant, and certainly in Peel, we'd want to make sure our vaccine coverage is at certain levels, and it would be a gradual reopening.
Absolutely. Dr. Lawrence Loh, Peel Region's Medical Officer of Health, thank you very much.
Thanks for having me.
Sabina Vohra-Miller is the founder of Unambiguous Science and also part of the South Asian Health Network. She is in Mississauga, Ontario. And Dr. Seema Marwhaha is an internal medicine physician and the editor-in-chief of Healthy Debate, and she is in Toronto. Good afternoon to both of you.
Hi. Thanks for having us.
Hi, good afternoon.
Sabina, I want to start with you just because you are part of this health network. You founded this health network, and you're very connected to people who have questions and concerns. And I wonder, are you hearing questions and concerns over the last 24 hours? And what's that like?
Absolutely. I'll be honest, it's been a little overwhelming because I've received lots of questions from people who I basically have been recommending to go get the first vaccine they're offered over the last couple of weeks. And everyone's coming up to me right now saying, well, did I make the right decision? Should I not have taken AstraZeneca? Was what I did correct or not? And it's caused a lot of confusion and it's caused a lot of chaos, to be absolutely honest.
Dr. Marwhaha, I do want to, at the same time as talking about all of this, also put some people at ease. So let's just say for those people who took AstraZeneca out there right now, Sabina's hearing from them. What do you say to people who did take it?
I would say emphatically that you made the right decision. My sister took the AstraZeneca vaccine about a week and a half ago, and we just had a chat about it yesterday, and she could not be more than happy that she took it. For the reality of Canadians, many of us are living in regions where the risk of getting COVID, getting a clot from COVID, being admitted to the ICU from COVID far, far, far outweighs any side effect that you'll get from any of the vaccines. And I think that cannot be overstated. And I've seen so many patients who were eligible for AstraZeneca who got admitted to the hospital with COVID. And so I want people to not regret their decision. What they did was right.
So Sabina, do you worry that some of the messaging that has come out has been at odds with what Dr. Marwhaha is suggesting there?
Yeah, I think that we definitely could have done a lot more to make sure that this messaging was not just transparent, but it was balanced, it was nuanced. It was also allowing people to make these informed decisions and empowering them with information. But instead, what ended up happening was some of this haphazard, and I'll be honest, I personally don't agree with the term preferred. And I think that has caused a lot of confusion. I think what we needed to have done was talked about risks and benefits, and the fact that everything in life carries risk. There's absolutely nothing you do in life that does not come with a risk. So we take calculated, informed risks on a daily basis. And with any medication and any vaccine, you do a risk-benefit analysis. And that's what, if you do a risk-benefit analysis, and if you're living in a province like Ontario, like in the West, where there is a lot of COVID, every extra day that goes by where you declined a vaccine that was offered to you means you have the risk of being exposed to COVID. And that is the risk that you're looking at over here. So when we're looking at the risks of COVID, we're looking at your area, you're looking at your age, you're looking at your exposure risk, you're looking at what happens if you bring COVID home. Do you live in a multi-gen housing? Are you going to be transferring COVID to now 10 other people? It also looks at your long-term health risks with getting COVID, long-haul COVID. And you take all of that and you take the benefits of the vaccine that accrue over time, in fact, and you compare that against the risk over here. And the risk over here is definitely a risk of a very serious side effect, but it's also very rare in the sense that it only occurs in around 1 in 50K to 1 in 100K people. So you have to do a risk-benefit analysis. And at what point does it make sense, in terms of making sure that you're getting the first vaccine that is offered to you?
And of course, it is a new vaccine, and people will take the birth control pill and perhaps not think about the same kind of risks because there are blood clot risks, higher blood clot risks associated with the birth control pill. But Dr. Marwhaha, the idea of whether we should call it preferred or not, some Canadians, many Canadians, would prefer to wait. And they now see timelines that will allow them to perhaps have that Pfizer or Moderna, because 8 million arriving over the course of May, 10 plus million arriving in June. What is the problem with people just waiting?
I mean, it's an individual decision that you have to make. I don't necessarily know if there's explicitly a problem with waiting, but I think language like preferred vaccines makes it seem like one is inferior or much less safe than the other. And I want to emphasize that all vaccines that have been approved by Health Canada have been deemed both safe and effective. And just because a vaccine is deemed safe does not mean that it's side effect free. And I think it's unrealistic for us to expect that any medical intervention would be without side effects. I think what worries me about this is that the majority of Canadians who are eligible for vaccines right now, who are really encouraging to get vaccinated, do live in high-risk areas, do have high-risk jobs, do have a real personal and family risk of getting ill with COVID. And I felt like the messaging yesterday was really directed towards low-risk people who may or may not be able to wait. And it was more just an overemphasis on really small risks for a small part of the Canadian population that may have the luxury to wait. But that certainly doesn't apply to anyone, at least, who's messaged me in the last 24 hours or any of the patients that I've treated with COVID.
Sabina, we've only got a few seconds left here, but one of the clips that we played at just before our discussion here was from New Brunswick's Education Minister, Dominic Carty, and he encouraged people to ignore NACI along with COVID deniers and those who don't wear masks. Putting those groups in the same bucket, what concern do you have?
I think that's an unfair comparison, to be absolutely honest. I have immense respect for NACI. They're doing an incredible job of keeping up with the science, and science is evolving so incredibly fast. And I think that they're a volunteer group. They've put in a lot of effort over the last year. So I personally don't agree with that comparison, to be honest. I do think that their communication could definitely use a lot more improvement to try and make sure that they're building confidence in Canadians as opposed to causing confusion.
Well, we'll leave it there. Thank you so much to both of you for bringing actually quite a bit of clarity, I think, to this discussion and reminding us about the different risks affecting different groups. Much appreciated for your time.
Thank you.
Thanks.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.